My name is Malori Bradley. I'm a registered nurse at King's Daughters Medical Center in Brookhaven, Mississippi in the emergency room. I'm also a student of Mississippi University for the Women. This is Courtney White. She's going to be starting med school in the fall at William Carey. Juliana Crosby's an RN labor and delivery at King's Daughters. Hannah's in the lab at King's Daughters. Travis is an EMT for Acadia in Louisiana. Holly works in the ER at Southwest in Macomb. And Heidi will be starting radiology school in the fall. And then Tabby White is an RN at Franklin County on the floor. So today we're going to learn how mental health has been affected since the start of the pandemic. Has mental health issues increased or decreased since the start of the pandemic? It has unfortunately increased. People that it's affected, everybody, children, adults, toddlers, children with autism, other learning disabilities, and the healthcare workers. COVID-19 has caused an increase in stress amongst our population. Feelings of fear, anger, sadness, worry, worsening chronic health conditions, mental health conditions, and an increased abuse of alcohol, illegal drugs, and actual prescribed drugs. Has mental health issues increased since the global pandemic? According to the World Health Organization, anxiety and depression has increased by 25% since the start of the pandemic. People have lost jobs and loved ones. If you look at the chart on slide 7, the age group most affected are 18 to 24 because we're not allowed to go out and be with our friends like we were before. We have to stay in a house amongst mom and dad or other family members. Other things that have been affected since the start: fathers and other family members are not allowed in OB appointments in the clinics. Only fathers are allowed in delivery rooms. Kids are going from in-classroom learning to online learning. Children and adolescents and teens who enjoy going to school to escape starvation and physical abuse are not able to do that because of the pandemic and the in-house homeschool learning. Adults have been affected due to the increase in demand for cars, food, homes. Some adults had to start working from home. Elderly are affected because they're not allowed to see their family members like they were on a regular basis, causing an increase in anxiety and depression. Technology that's been brought about since the start of the pandemic: online shopping, telehealth, paperless pay stubs, at-home COVID tests, Zoom meetings, distant learning, and online entertainment. Has technology helped or hurt our population? I personally believe it has hurt our population due to more people spending time on a computer or on a TV and not getting out and doing. I also feel like children and adolescents aren't able to learn good social skills due to being in front of a tablet or a TV all the time. One big population affected is our healthcare workers. All of us being healthcare workers, we know just how bad it has affected our world since the start of the pandemic. We have increased in anxiety and depression. A lot of us are leaving our jobs to go traveling to make more money and work less. Our small town hospital is struggling with staff and nurses, staffing floors. We're unable to do so because of the nurses leaving. Has healthcare changed since the start? Yes, it has. It's changed in many ways. Like I said, nurses leaving their jobs. You have to have a mask to get in anywhere now. COVID-19 vaccine mandates are causing nurses to also leave their job because they're not able to have freedom of choice. They're being made to do something they don't want to do. And patients are having to visit their doctors through Zoom meetings. How to cope with the stress and the anxiety of the pandemic: take a long walk, see your doctor, get put on the medicine you need to, unwind, visit friends and family through telephones, use the Zoom meetings if you can. Other ways would be take deep breaths, stretch, meditate, limit your alcohol use. That's pretty much all the high points. Does anybody have any questions?
I do.
What you got?
How would you go about controlling the suicide rates due to COVID?
I would come up with community support groups to help people who are struggling with the pandemic get together and talk about their thoughts and feelings and suggest things from there.
That's a good answer.
I've got a question. Okay, so as a incoming medical student, I really struggled a lot finding people that would let me shadow whenever I was going into the trying to get into medical school. And so while I'm not directly, interacting with patients out of school, how has that affected incoming nurses and doctors who basically went through this telehealth learning period.
Talking about how they were not able to physically put hands on a patient.
Right, like I no experience.
I feel like it has affected our healthcare world totally because, well, not so much doctors. Well, I guess it would affect doctors because they're not able to physically put hands. Their clinicals have altered. It kind of, within the time frame now, is coming back to where residents are coming in and shadowing doctors, able to perform different procedures within their scope. Whereas nurses, when the pandemic was in a high, they were throwing nurses right out of school, giving them a temporary license to practice without actually having their registered nursing license. I believe that was very dangerous because 2 staff units that were not, they didn't have the staff.
Right, so it definitely had a negative impact.
I believe so. My personal opinion. Anybody got any questions? Any other questions? Well, thank y'all for listening to me. I hope you got a little bit out of my presentation. Thank you.
Thank you.